This segment is brought to you by Netcare. You're in safe hands.
Diabetes is a growing health challenge, not just internationally, but in South Africa too, with 33% of diabetic patients coming from KwaZulu-Natal. Joining me today is Dr. Singh and Dr. Govender, founders of the Multidisciplinary Center for Diabetes, Endocrinology and Heart Care here at Netcare Mshlanga Hospital. Dr. Singh, thank you for joining me today.
Thank you, Maria. It's a pleasure.
So before we start talking about this world-class multidisciplinary center that we find ourselves in, I'd like to talk about diabetes and in particular, how it affects the heart.
Maria, diabetes is essentially a vascular disease affecting the heart, the blood vessels to the brain, and the vessels to the legs, and in fact vessels to every part of the body. Most serious complications are related to heart attacks and strokes.
What are some of the risk factors?
When you look at the risk factors, we by and large talking about type 2 diabetes. Type 1 diabetes is another disease altogether, but type 2 diabetes is essentially a lifestyle related disease related to physical inactivity, high cholesterol, predominantly obesity, leading to insulin resistance.
So then what would be some of the steps people could take in terms of prevention?
Prevention starts at day one when you're born. Some people will say in utero, but it's very important that parents bring up their children properly with proper dietary advice, proper advice related to sporting activities, physical activities. That has to start early in life, although it manifests much later. But by the time diabetes is detected and diagnosed, the complications, many of them, in one way or another, have already set in.
The name is Shyam Naidu. I am currently 65 years old. Fortunate to have a family, a lovely wife, Carmony, and 3 kids, a daughter and 2 sons. I was born with a problem, which was the leaking heart. At 9 months, I had to go through a procedure or operation, which gave me a lease in life. I thus progressed as a young man, kept busy, never gave a chance to the mind to concentrate on my health, but tried to have more fun. And I think pretty normal with any young person out there. At 24, I got married. With the perseverance of my wife, she obviously didn't see something right, so she kept constantly speaking to our GP. Dr. B.G. Pillay recommended me to Dr. Singh, saw him 33 years ago, which was quite an emotional experience on our first visit to him. And at that stage, as I say, God sent, Trishan was there. He discussed the whole issue with us. And unfortunately, there was no wasting time. As much as I said, no, could we do it maybe a week later, there was no wasting time. I had to get to hospital on that Monday morning. Prior to the Monday morning, at Trishan's office, the emotion that had sprung up really had an effect, and through his kindness and consoling, I wouldn't forget the oranges, that gave me some sort of, lift. Then got to hospital on Monday. Before you knew it, I was done, dusted and recovering a week later.
Dr. Singh, we heard from Mr. Naidu. How were you involved in his treatment and his journey?
Mr. Naidu has been with me for 33 years. I was a very, very young cardiologist then when he first saw me. When Mr. Naidu came to me with tight aortic valve, we had to replace the aortic valve. That was done successfully. But in order for him to survive now 34 years later, it's not only because he had a good valve replacement. It's because over the years we picked up all the other problems that evolved. High blood pressure, cholesterol, diabetes, hypertension. As we progressed through that journey, so did medicine progress. So Mr. Naidu enjoyed the progress in medicine that was made with regard to the treatment of high blood pressure, better drugs, cholesterol, better drugs, the statins, which became better and better, heart failure treatment, diabetes. The treatment of diabetes has evolved to such an extent that it has now become a specialty in its own.
As a cardiologist, why did you believe that opening up the center here at Netcare Mshlanga Hospital, why was it so important to you?
KwaZulu-Natal is, and particularly Durban and surrounding areas, is the epicenter of type 2 diabetes. So our center is ideally situated because we are situated on the ground floor of Mshlanga Hospital itself, and we have the wards and theatres and everything we need around us and above us. But in saying that, Sedation Governor and I, Sedation is diabetologist, endocrinologist, started this project, or the vision of this project, at least 3 to 4 years ago, where we said the diabetic patient today has to be holistically treated. You need the other fields involved with diabetic care, and by that I mean you need the cardiologist, diabetologist, you need the nephrologist, that's the kidney specialist, you need the wound care specialist, diabetic educator, podiatrist, the eye specialist, the vascular surgeon, the neurologist, X-ray people, you need the laboratories. So it has to be multidisciplinary because diabetes affects every organ in the body because it's a vascular disease. So you can't treat a diabetic patient in isolation without treating the patient holistically with all these specialties that I mentioned being around you for easy access to the diabetic patients.
It's important for individuals to have not just a checkup with your cardiologist. There is an expert in a different field. And that is where Trishan actually put me and said, you know what, Dr. Govender is here. He's the man that needs to handle your diabetes. That was my first experience going to Dr. Govender.
So we chatted to Mr. Naidu earlier. He had heart issues, but at the same time, he did suffer with diabetes and he was referred to you. Can you tell me a little bit more about his story and his journey?
So Mr. Naidu was referred by Dr. Singh to us to take over his diabetes management. Now, Mr. Naidu has got a valvular problem that Dr. Singh has been attending to, but diabetes not only affects the heart in multiple ways. The ones we're looking for is, as Dr. Singh mentioned earlier, is coronary artery disease. So we're trying to improve his long-term outcome in terms of diabetes care by reducing his long-term risk for coronary artery disease.
As an endocrinologist, why did you think it was important for this center to have been opened?
So when I came into practice in 2014, I saw a deficiency in diabetes in the sense that a patient who's diabetic has a journey that they go through throughout their lifespan. And this may be completely uncomplicated, or it might be a very complicated journey. So often what we find is once a patient starts to develop complications, you often need a multidisciplinary team to work with. What I found was when you had multiple doctors who were situated in different hospitals or in different centers, it was very difficult to coordinate their care. And often the care became fragmented because we were ultimately the center point of their care. And if you didn't get input from all the attending doctors, it was very difficult to manage their disease. So the idea was to put together a team of specialists and allied healthcare providers so that it made it a lot easier for the patient and it made it a lot easier for us to manage the patient.
If you have all these fields and specialties in one center, thereby giving you the best outcome and results for what you're trying to achieve in that diabetic patient.
Enjoy life. That's the oldest thing of living, is to enjoy life. And to enjoy life, you've got to have the right health. To have the right health, you've got to have the right people. Being in the environment that I am now in, I'm very pleased.
So essentially, we created the center to provide holistic care for a diabetic patient, to provide better care today so we can get a better outcome tomorrow.
This segment is brought to you by Netcare. You're in safe hands.